take care of the elderly and the disabled in our Medicaid program. By the way, that is probably more than most states are spending today. So we have thought this through carefully. We care about people and their medical condition and their families because we're all in this together as Americans. And I think the bill we have before us today works. It works to take care of those most in need. It works to make sure that the people can get access to insurance. And I'll tell you what, it is a first step in a many-step process to also look at families who are dealing with opioid addiction and what we can do there. There are efforts at NIH, which we just supported yesterday, to fund medical research so that we can get to cures for those who have diseases and other afflictions. We are fully committed to improving health care not only for Americans, but around the globe through innovation and scientific discovery. And with that, I yield back the balance of my time.
Gentleman from Virginia.
Mr. Speaker, I remind my colleague that his vote for this health care bill will take away protections for over 600,000 people in Oregon with pre-existing conditions. Mr. Speaker, I yield for the purpose of a unanimous consent request to the gentleman from California, Mr. Takano.
Mr. Speaker, I ask unanimous consent to enter into the record a letter from the Consortium of Citizens with Disabilities, which states this legislation will dramatically cut Medicaid services that are vital to people with disabilities and seniors.
Without objection.
Mr. Speaker, I yield 1 minute to the gentleman from California.
Gentleman's recognized for 1 minute.
Mr. Speaker, there are 7 million veterans who are eligible for VA care but not enrolled at the VA. All of them could be denied access to the tax credits in this bill. And everyone in this chamber needs to understand how. On page 10, line 6 of Manager's Amendment number 4, it states that an individual is not eligible for tax credits if they're eligible for care as defined by U.S. Code 5000 F1A. This code specifically includes VA care. So this means that those 7 million veterans who are eligible for VA care, even if they are not enrolled, would not have access to the tax credits in this law. This is not fear-mongering. This is not hyperbole. This is the text of the bill we are voting on today. This bill jeopardizes health care for up to 7 million veterans, and everyone should oppose it. Thank you, and I yield back.
Gentlelady from Tennessee.
Mr. Speaker, reserve.
Gentlewoman reserves. Gentleman from Virginia.
Mr. Speaker, I yield 3 minutes to the Democratic whip, the gentleman from Maryland, Mr. Hoyer.
Gentleman from Maryland is recognized for 3 minutes. Without objection.
Mr. Speaker, Republicans now control all of our government. Whatever happens to our health care system will be their responsibility, including what has already happened since January with the destabilizing of our insurance markets and health plans, announcing rate hikes due to uncertainty. They will be held accountable for what happens. Today, Americans will have an opportunity to see exactly where their representatives stand. This vote is a simple one. It votes to kick 24 million Americans off of their health insurance coverage. I don't say that, CBO says that, which is perhaps why we don't have a CBO report on the amendment. It includes 7 million people who are covered through their employers. It is a vote to make coverage unaffordable for 1 in 4 Americans with pre-existing conditions and ration care through high-risk pools. It is a vote to impose an age tax on old Americans, some $1,700 to $14,600. That's quite a hike. It's a vote to force Americans to pay more for less, to raise premiums 24 to 29% on average over each of the next 2 years. CBO says that, not me. And no matter how Republicans try to spin it, healthcare advocates from the AMA to AARP to everybody that follows have said that it ends protection for those with pre-existing conditions. It ends protections for those with pre-existing conditions. It ends protections for those with pre-existing conditions, and it takes away essential health benefits like doctor visits, emergency room visits, and prescription drugs. So this, Mr. Speaker, will be a very instructive vote. It will show the American people if Republicans stand with those who don't want to lose their coverage, some 55% now and 75% saying fix it, don't repeal it, or if they stand with a president who wants to claim a victory but doesn't even seem to know what his own Trump Care bill says. I recommend, as a political strategist who's concerned about 2018, that you once again withdraw this bill. Instead, we ought to work together to make sure that the Affordable Care Act works for all Americans and deliver on the promise that President Trump made from that rostrum when he said that he wanted insurance for everybody. Not kick 24 million off, for everybody. Not make seniors pay more, for everybody. Not to put Medicaid at risk, for everybody. It's far less expensive and far better. I urge my colleagues, come to your senses, defeat this bill.
Gentlelady from Tennessee. Gentlelady from Tennessee.
Mr. Speaker, I'd like to remind the other side that if they read the bill, they will see under Section 137, it says, no limiting access to coverage for individuals with pre-existing conditions. Nothing in this act shall be construed as permitting health insurance insurers to limit access to health coverage for individuals with pre-existing conditions. It is now my honor, I do not have time to yield. It is now my honor to, yield 4 minutes to the gentleman from Texas, Mr. Brady, the chairman of the Ways and Means Committee.
Gentleman from Texas recognized for 4 minutes.
Thank you, Mr. Speaker. I first want to thank Chairwoman Black for her leadership on this effort, as well as Chairman Walden, the Energy and Commerce Committee, for incredible work. And as chairman and on behalf of the Ways and Means Committee, who worked alongside you, I'm honored to speak in support of the American Health Care Act because it guarantees coverage for those with pre-existing illnesses. It guarantees coverage for those with pre-existing illnesses. In fact, this bill takes decisive action to repeal all the bad parts, all the damage done by Obamacare, and begin a thoughtful step-by-step process to deliver a patient-centered healthcare system, not a Washington-centered healthcare system, the American people. While Obamacare has helped some, far more have been hurt by this law, and more Obamacare failures are piling up every day. Just yesterday, Aetna announced that it will exit Virginia's individual health market next year. And it's not just the state's Obamacare exchanges they are leaving behind. Aetna will not offer any plans next year in the individual market in Virginia. Same thing is happening in Iowa. And Democrats, my friends on the Democratic aisle, have done nothing to stop this, nothing. But today, because of this bill, thousands of people will have hope for a new plan to provide the health care coverage they need. Millions of Americans throughout the country are facing just terrible options. People in Texas have been hit particularly hard. Between last year and this year, 9 health care insurers have exited Obamacare exchanges in the Lone Star State. No other state saw more insurers leave. For my families, the failures of this law have come to mean some incredibly tough choices they've had to accept under Obamacare. You can't access affordable coverage that's tailored to what they need. They've had to learn how to get by as their monthly health premiums just skyrocket each and every year, bigger than their mortgage payments. They've had to choose between paying out of pocket for the care they need or not getting care at all. And under Obamacare, the ability to receive treatment from a doctor you know and who knows you has become a luxury that too many can't afford. Today, with the American Health Care Act, the Republicans propose we have an opportunity to provide immediate relief from this failing law. More than that, we can provide Americans with real choices in health care, not the painful decision they forced to live with under Obamacare. Under the Ways and Means Committee area, this starts by repealing the law's crushing taxes and mandates, and that's where Ways and Means takes action. Under Obamacare, the individual employer mandate penalties allow Washington to strong-arm you, to strong-arm Americans in Obamacare plans you do not want and cannot afford. Not anymore. Under the Republican plan, we repeal the individual employer mandate tax penalty so Americans have the freedom to make the health care choices that are right for them. Under Obamacare, over $1 trillion of taxes were imposed on the American people. Under the Republican plan, those taxes are gone, those taxes that burden American small businesses and families. And under our plan, we provide increased health savings accounts so Americans can save easier for the out-of-pocket costs that hit them under any health care. And then we create a personal individual tax credit so Americans can buy plans that are right for them, not what's right for government. Health care premiums, they can choose a plan that can go with them from job to job, state to state, home to start a business or a family, and even into those pre-retirement years. Today is about taking on a collapsing Obamacare and replacing for the American people health care that they want, they can use, and that they can afford, driven not by what Washington wants, but driven by what American families need in their health care. I urge this support.
Gentleman from Virginia.
Thank you, Mr. Speaker. I remind my colleague that his vote for this bill could take away protections of over 4.5 million people with pre-existing conditions in Texas who might have access to coverage, but if they have diabetes, their rates could go up $5,000. Mr. Speaker, I yield 1 minute to the gentlelady from North Carolina, Ms. Adams.
Gentlelady from North Carolina is recognized for 1 minute.
Thank you, Mr. Speaker, and I thank the gentleman for yielding. After his latest failed attempt to roll back the ACA, Speaker Ryan declared to the American people, Obamacare is the law of the land. And less than 50 days later, Paul Ryan shamefully is going against his word, trying to ram Trump care down our throats. It's an embarrassment that we're wasting taxpayer dollars to again consider Trump care, or as I call it, Trump don't care, a reckless plan that does nothing to make health care better. Trump care gives the rich and big corporations a $600 billion tax break. It forces families to pay higher premiums and deductions, placing health care out of their reach. Trump care forces seniors to pay higher costs, and it changes Medicare as we know it. It strips essential health benefits and protections for people with pre-existing conditions. What a pitiful display of partisan politics. Trump care is so bad, Republicans have exempted themselves from it. They don't want Trump care. The medical industry doesn't want Trump care. Democrats don't want Trump care. Why don't House Republicans listen? The people don't want it, and I won't support it.
Tennessee. Gentlewoman reserves the balance of her time. Gentleman from Virginia.
Mr. Speaker, I ask unanimous consent to enter into the record a letter from Common Sense Kids Action that explains that the bill jeopardizes the health care and well-being of America's kids and will alarm any parent who understands the importance of health insurance for their children and family.
Without objection.
Mr. Chairman, Mr. Speaker, I yield for the purpose of a unanimous consent request to the gentleman from New York, Mr. Jeffries.
Mr. Speaker, I ask unanimous consent to enter into the record a letter from SEIU which states this legislation will leave millions without health insurance and decimate the Medicaid program.
Without objection.
Mr. Speaker, I yield 1 minute to the gentleman from New York.
Gentleman's recognized for 1 minute.
The House majority has once again made clear that under Republican rule, the system is rigged. The fix is in. The deck is stacked against hard-working Americans. And Exhibit A is your reckless Republican health care plan. Under Trump care, 24 million Americans will lose access to health insurance. Under Trump care, a draconian age tax will be imposed on people between 50 and 64. Under Trump care, costs will go up, premiums will go up, co-pays will go up, deductibles will go up. Under Trump care, tens of millions of Americans who are living with pre-existing conditions will be screwed. House Republicans are out to destroy the American healthcare system as we know it. But you will be held accountable for the cruel and unusual punishment that you have decided to inflict on the American people. Vote no against this draconian piece of legislation.
Apparently, not the last time, the chair would remind members to direct their remarks to this chair. Understood? Gentlelady from Tennessee.
Mr. Speaker, I reserve.
Gentlelady reserved. Gentleman from Virginia.
Mr. Speaker, I ask unanimous consent to enter into the record an article in Consumer Reports dated May 2nd, 2017, entitled How the Affordable Care Act Drove Down Personal Bankruptcy.
Without objection.
Speaker, I yield 1 minute to the gentleman from New Jersey, Mr. Norcross.
Gentleman's recognized for 1 minute.
Thank you. A month ago, I was ready to speak right here on the floor when this bill was abruptly removed. Apparently, it wasn't bad enough that day. Wasn't harmful enough. But now it's back worse than ever. So bad, it might actually pass. I don't have a lot of time to explain, but let me tell you two groups that are really going to say thank you. It's the billionaires and it's the undertakers. This bill will make health care more unaffordable and preventable deaths. Meanwhile, it gives $800 billion to the wealthy, to the billionaires. Trump Care brings us higher costs, less coverage, guts the benefits, crushing age tax, and steals from Medicare. And in my district alone, 43,000 people will lose coverage. 9,000 of those are children. Elderly, the Medicaid will be lost close to 2,000. There's a reason they're trying to jam this down our throat. There's no CBO score because they don't want to hear new score. Speaker, let me make it plain. Let's put this bill in a coffin, not Americans. Let's kill and bury this bill. Thank you.
Gentlelady from Tennessee. Gentlelady from Tennessee.
Mr. Speaker, it's now my honor to yield 1.5 minutes to the distinguished gentleman from Louisiana, Mr. Scalise, our whip.
Gentleman's recognized for 1.5 minutes.
Thank you, Mr. Speaker. I want to thank the chairwoman of the Budget Committee for yielding. And I rise in strong support of this bill, Mr. Speaker, that finally provides relief to the American people across this country from the failures of Obamacare. And just how bad is it failing? You don't have to look any further than what happened in Iowa yesterday, where literally they're going to have, in 94 out of 99 counties, nobody to write insurance for people that are in the Obamacare exchanges. So what do the people, Mr. Speaker, that are opposed to this bill say to those millions of people in Iowa who are about to have no place to go to get health care? What are the people that oppose this bill, Mr. Speaker, going to say to the millions of people with pre-existing conditions across the country who are being faced with double-digit increases in their health insurance every year? And oh, by the way, premiums and deductibles as high as over $10,000. So what we're replacing it with, Mr. Speaker, are reforms that actually lower premiums, that actually put patients back in charge of their health care decisions, so that elitists up here in Washington won't tell you what you have to buy. You actually get to make that choice yourself. And you get to focus on plans that are good for your family at lower costs so that you can be in charge. And oh, by the way, reforming the Medicaid system, one of the most broken forms of health care, so that states actually have the ability to innovate and help low-income families. This bill is important, Mr. Speaker, to rescue the American people from a law that has failed dismally. Let's end the skyrocketing premium increases. Let's lower costs and put patients back in charge of their health care decisions. I yield back the balance of my time.
Gentleman from Virginia.
Mr. Speaker, I remind my colleague that his vote for this bill can take away protections for over 800,000 people with pre-existing conditions in Louisiana. For example, those with breast cancer could see their premiums go up by over $34,000. Mr. Speaker, I yield to the gentlelady from Delaware for the purpose of a unanimous consent request.
Mr. Speaker, I ask unanimous consent to enter into the record a letter from AARP which makes clear health care will be sabotaged under this bill, and health care costs for older Americans will, quote, dramatically increase, end quote.
Without objection.
Thank you, Mr. Speaker. Mr. Speaker, I yield 1 minute to the gentlelady from Delaware.
Gentlelady is recognized.
Thank you. Mr. Speaker, I know in these polarized times, we often forget that we are connected, and we are all connected to each other. A sick, uninsured employee affects the bottom line of a small business. Uncompensated care in the emergency room, we all pay the bill. When a child from an uninsured family goes to school with an undiagnosed virus, not only does it impact his or her ability to learn, it impacts other kids and puts them at risk. We are all connected. As Martin Luther King so powerfully said, we may have come over on different ships, but we're all in the same boat now. Mr. Speaker, it's time we start rowing together. Unfortunately, this bill fails to recognize this. It still fails. In that we're connected, and that instead of bringing us together, this simply divides us by providing less coverage, imposing an age tax, forcing people to pay more, and stripping key protections. I urge all my colleagues to vote no on H.R. 1628. Thank you, and I yield back my time.
Gentlelady from Tennessee reserves. Gentleman from Virginia.
Thank you, Mr. Speaker. Mr. Speaker, I yield 1 minute to the gentleman from Illinois, Mr. Christian Morthy.
Gentleman's recognized for 1 minute.
Unanimous consent first.
Mr. Speaker, could I yield for the purpose of a unanimous consent request first?
Sure.
Thank you.
Mr. Speaker, I ask unanimous consent to enter into the record a letter from the American Medical Association that states, quote, not only would the AHCA eliminate health insurance coverage for millions of Americans, the legislation would, in many cases, eliminate the ban against charging those with underlying medical conditions vastly more for their coverage.
Without objection.
Thank you. Now to yield 1 minute to the gentleman from Illinois.
Gentleman's recognized for 1 minute.
Thank you, Mr. Speaker. The country will not remember what we say here today, but it will never forget what we do today, especially if we make the wrong choice and adopt this bill. The 159 million Americans whose employer-sponsored health care could be cut would never forget. Neither would the 24 million Americans who would lose their coverage or the 52 million people with pre-existing conditions who would struggle to find health insurance again. If this bill passes, Mr. Speaker, no cancer survivor denied coverage will forget. No survivor of sexual assault charged more for her ordeal will forget. And no parent struggling to afford emergency surgery for a newborn child could ever forget. They would not have that choice. But today, we have one. We can choose to vote no and prevent millions of Americans from losing their health care. We can choose the right path rooted in morality, decency, and reason. I implore you, vote no. I yield back.
Gentleman from Tennessee.
Reserve.
Gentlewoman reserves. Gentleman from Virginia.
Mr. Speaker, I yield for the purpose of a unanimous consent request to the gentleman from New York, Mr. Espaillat.
Mr. Speaker, I ask unanimous consent to enter into the record a letter from ASME which states this bill will cause millions to lose their health coverage and return to the days when even inadequate coverage was unaffordable.
Without objection.
Speaker, I yield 1 minute to the gentleman from New York.
Mr. Speaker, I strongly oppose this bill. We all should. Protecting ACA is a top issue for my constituents. Constituents like Leslie Gautier, who without the protections of the ACA would not have gotten the treatment for leukemia that she was diagnosed just at the age of 22. Leslie is now in remission, thanks to Obamacare. For Leslie, the ACA protections like essential health benefits were a matter of life and death. This Republican bill would destroy those patient protections. Under the ACA in my district, 5% drop in uninsured rates, subsidized based on income and region and not on age. Medicaid expansion covering 156,000 people will be lost. The president promised not to cut Medicaid. This bill guts it by $880 billion. This bill is a gut punch to America. Pregnant women seeking health care, kicked to the curb. Patients with pre-existing conditions, kicked to the curb. Senior citizens who will have to pay more for less, kicked to the curb. Over 24 million people, including 6.5 million Latinos, kicked to the curb. We demand Republicans stop kicking to the curb Americans. Stop this bill.
Gentleman's time has expired. Gentlelady from Tennessee.
I reserve.
Gentlelady reserves. Gentleman from Virginia.
Thank you, Mr. Speaker. Mr. Speaker, I yield for the purpose of a unanimous consent request to the gentlelady from California, Ms. Lee.
Thank you, Mr. Speaker. I ask for unanimous consent to insert into the record the Service Employees International Union's letter voicing strong opposition to the deadly American Health Care Act for their 2 million members.
Without objection.
Thank you. Mr. Speaker, I now yield for the purpose of unanimous consent request to the gentlelady from California, Ms. Waters.
Mr. Speaker, I ask unanimous consent to enter into the record a letter from the Association of American Medical Colleges, which states the treatment of essential health benefits and health status underwriting dilutes protections from many Americans and would leave individuals with pre-existing condition facing higher premiums and reduce access to vital care.
Thank you, Mr. Speaker. I yield 1 minute to the gentlelady from California.
Gentlelady is recognized for 1 minute.
Thank you very much. I rise to caution those Republicans who have been allowed themselves to be persuaded by this president into supporting this terrible bill, which would leave millions of Americans without health care and raise the cost of care for millions more. You are going to pay a terrible price for not protecting your constituents. Trump Care will cause 24 million Americans to lose their health coverage and slash Medicaid by $880 billion. For older Americans, premiums, deductibles, and copayments will skyrocket. Those between the ages of 50 and 64 will be forced to pay premiums 5 times higher than what others pay for the same coverage. This crushing age tax will fall on some of the most vulnerable members of our society, elderly people on fixed incomes who often have serious health issues. Meanwhile, hidden in this bill is an outrageous tax breaks for billionaires. Trump Care gives $600 billion in tax cuts to large corporations and wealthy people, including $2.8 billion to the 400 richest families in America. The MacArthur Amendment made this bill even worse by gutting protections for people with pre-existing conditions.
Gentlelady from Tennessee.
Reserve.
Gentlelady reserved. Gentleman from Virginia.
Thank you, Mr. Speaker. I yield 1 minute to the gentleman from Michigan, Mr. Conyers.
Gentleman from Michigan is recognized for 1 minute.
Thank you, Mr. Speaker, and I also thank Mr. Scott. Members of the House, I've been here for 5 decades, and I can't recall a time when we've debated something so obviously harmful to seniors and working people in this country. This bill strips health care from 24 million people. It requires seniors to pay sometimes 100% or more of their income in premiums. This legislation drastically and dramatically cuts Medicaid, directly contradicting President Trump's claim not to. In Michigan, fully half of all children rely on Medicaid. In my district alone, 56,000 people will lose coverage, including 16,000 children and 3,200 seniors. Let's be clear, if we pass this bill, people will die.
Gentleman's time has expired.
Health care is a right and not a privilege.
Gentlelady from Tennessee.
Continue to reserve.
Gentlelady reserved. Gentleman from Virginia.
Thank you, Mr. Speaker. For the purpose of unanimous consent request, I yield to the gentleman from Minnesota, the highest-ranking enlisted soldier ever elected to Congress, Mr. Waltz.
I thank the gentleman. Thank you, Mr. Speaker. I ask unanimous consent to enter into the record a letter from the Paralyzed Veterans of America urging rejection of the latest version of the American Health Care Act.
Without objection.
Mr. Speaker, I yield 1 minute to the gentleman from Minnesota.
Thank you, Mr. Speaker. There's many reasons that people may come to this and come to the conclusion this is not the piece of legislation for them. I would argue most egregious amongst this is the manner in which it was done. There was clearly an error made on the 7 million veterans you heard about. I do not question a single member's commitment in here to caring for veterans. You did not do it on purpose. You did it because you had to meet the arcane rules of the Senate. So you stripped it out, and you will, by all intents and purposes, fix it in the Senate. For you, I would say good luck with that. But for the members who are sitting here, why would we not debate this? Why would we not fix it? Why would we not go through regular order so all of us would ensure there is not a loophole that would deny coverage to 7 million veterans? This is too important to rush. It's too important to make errors like this. It's darn sure too important to count on the Senate to fix it, and it was our responsibility. So here we sat with 30 seconds amongst 15 of us to make points that are important to the American public. I urge my colleagues, reject this, come back and do it right, and provide the health care our veterans deserve. I yield back.
Gentleman's time has expired. In case anyone has forgotten, address your remarks to the chair. Lady from Tennessee.
Reserve.
Gentleman from Virginia.
Thank you, Mr. Speaker. Mr. Speaker, I yield for the purpose of unanimous consent request to the gentlelady from Hawaii, Ms. Hanabusa.
Gentlelady.
Thank you, Mr. Speaker. Mr. Speaker, I ask unanimous consent to enter into the record a letter from Save Medicaid in Schools, a coalition of dozens of organizations. This letter states that this bill jeopardizes health care for the nation's most vulnerable children, students with disabilities, and students in poverty.
Without objection.
Thank you, Mr. Speaker. Mr. Speaker, I yield 1 minute to the gentlelady from Hawaii.
Gentlelady is recognized for 1 minute.
Thank you, Mr. Speaker. Mr. Speaker, I rise in strong opposition to H.R. 1168, the Trump Care Act. I am fortunate to have been born and raised in Hawaii, where we are taught to never forget our seniors, our kupuna. AARP, with a national membership of 38 million and over 150,000 in Hawaii, remains steadfastly opposed to Trump Care. The amendment proposed today makes the bill worse, and for our kupuna in Hawaii and nationally, they will have no relief from the age tax. This chart shows how much more at age 64 a person will pay in premiums, almost $6,800 in Hawaii, where we have one of the best health cares. And 55-year-old will see a premium increase of almost $3,600 a year. Why? What did the seniors do that Trump Care wants to penalize them and pay such a premium when they're moving towards retirement? Trump Care is out to get those 50 to 64 with this terrible age tax. Vote against H.R. 1168. These numbers will not be different in your districts. Yield back.
Gentlelady from Tennessee.
Reserve.
Gentleman from Virginia.
Mr. Speaker, could you advise us how much time is remaining on both sides?
Gentleman from Virginia has 5.5 minutes remaining. The gentlelady from Tennessee has 2.5 minutes remaining.
Thank you, Mr. Speaker. I yield for the purpose of a unanimous consent request to the gentlelady from Illinois, Ms. Bustos.
Thank you. Mr. Speaker, I ask unanimous consent to enter into the record letters from the United Steelworkers, the AFL-CIO, and the International Brotherhood of Teamsters in opposition to this bill.
Without objection.
Thank you, Mr. Speaker. Mr. Speaker, I yield 1 minute to the gentlelady from Illinois.
Gentlelady is recognized for 1 minute.
Thank you, Mr. Speaker. This is not how Washington is supposed to work. We're supposed to improve the lives of hardworking people. Instead, this reckless and dangerous Trump Care bill would undermine both the health and the economic security of millions of Americans. People like Emily Carlson. She's a small business owner and mother of 2 from rural Abingdon, Illinois. She lives with MS, a lifelong and very expensive pre-existing condition. Before health care reform, Emily and her husband Kevin, a farmer, often had to sit around the table at night, go over their bills, and decide between sickness or debt from 1 month to the next. If this bill passes, that's a choice they're going to have to face once again. For families like the Carlsons, Trump Care means higher costs, fewer choices, and worse coverage. Trump Care is a bad deal for Americans, but it's devastating for rural Americans. Right now, there are nearly 700 rural hospitals at risk of closure. This bill will pull the plug on far too many of them, killing thousands of jobs and ripping the economic heart out of small towns across our nation. It's time to put hardworking families first, do the right thing, and vote against this bill. Thank you, Mr. Speaker. I yield back.
Reserve.
Gentlelady from Tennessee reserves. Gentleman from Virginia.
Thank you, Mr. Speaker. Mr. Speaker, I yield for the purpose of unanimous consent request to the gentlelady from New Hampshire, Ms. Shea Porter.
They want me to submit those letters.
Mr. Speaker, I ask unanimous consent to enter to the record a letter from the American Cancer Society which states cancer patients and survivors need affordable, accessible insurance coverage with no pre-existing condition exclusions or annual and lifetime caps, and that high-risk pools have failed to meet these basic needs.
Without objection.
Thank you. Mr. Speaker, I yield 1 minute to the gentlelady from New Hampshire.
Without objection, the gentlelady is recognized for 1 minute.
Thank you, Mr. Speaker. I oppose this cruel bill on behalf of my constituents, especially those that would hurt the most, people with pre-existing conditions, older Americans, veterans, and lower-income people. If this bill passes, we'll go back to the days when people with pre-existing conditions could be denied coverage or charged more, when insurers could decide whether or not to cover basic care like hospitalization, and when sick babies might hit their insurer's lifetime coverage limit before they could even walk. Under this bill, older Americans will pay more. In fact, Americans aged 50 to 64 would pay premiums 5 times higher than others. Veterans will lose access to tax credits that make private coverage affordable, and lower-income people will be hurt. Taking away Medicaid expansion would put affordable coverage out of reach for millions and set us back in the fight against the heroin, fentanyl, and opioid crisis. Instead of this cruel bill, let's come together to improve health care, not take health insurance away from millions just to give tax credits to the wealthiest. We're better than that. I yield back.
Gentlelady from Tennessee.
Mr. Speaker, I yield 30 seconds to myself.
Gentlelady is recognized for 30 seconds.
The American Health Care Act has gone through many fits and starts over the last few months. This bill begins to fulfill our promise to the American people by reducing costs for American families. It eliminates Obamacare's burdens on small businesses and families and protects those with pre-existing conditions. We must continue to work to build on this. With that, I would like to yield 1 minute to the gentleman from California, our Majority Leader, Mr. McCarthy.
The gentleman from California is recognized for 1 minute.
Well, I thank the gentlelady for yielding. But more importantly, I thank Congresswoman Diane Black for more than 4 decades as a nurse, for caring for the sick. I know her passion for the unborn, and for her work on this legislation. Now, Mr. Speaker, Americans are a practical people. We know that we can have fair health care that helps those who need it without trapping everyone in a government-run system dreamed up by Washington's central planners. Now, contrary to our freedom, Obamacare forced the American people to purchase insurance. Contrary to our well-being, Obamacare imposed taxes we cannot bear. Contrary to what is responsible and right, Obamacare made Medicaid unsustainable for the people most in need. And contrary to common sense, Obamacare regulations continue to drive up the cost of insurance beyond what people can afford. You want to know how Obamacare is working? Just read this week's papers. Now, let me take you all the way back to yesterday. This is the headline. Medica, the last insurer selling individual policies in most of Iowa, is unlikely to exist. So now, 94